Joe says, Clive, to avoid repeating mistakes, the government must learn now from reviews already done, for example, by scientists from independent SAGE. To fail to avoid predicted and predictable errors resulting in deaths, and second time is bordering on criminal negligence. The problem is a lack of true accountability, says Joe. Thank you for that. The Johnson government has learned nothing, says Pauline. Mitigation of highly effective border control, test and trace and isolate, including financial support for the poorest, etc., plus wearing masks, e.g. Korea style, urgently needed to start lifting the lockdown. Paul from Erith says COVID review not closing the UK border in January 2020 and not enforcing compulsory mask wearing. Indeed, let's remember that even beyond that time, Boris Johnson was still boasting about shaking hands with COVID patients in hospitals, saying there was no evidence about masks, and we didn't. I mean, we did stop some flights coming in from China, but, you know, I would hope so, the very, very least. But we didn't do much to control our borders at all, and frankly, I still don't think we are. 0345 6060 973. We'll take some more calls in a moment. Let's bring in now Richard Horton to talk about this year. He's editor-in-chief of the Lancet, the medical journal, and he's also author of the COVID-19 Catastrophe, What's Gone Wrong and How to Stop It Happening Again. Exactly who we need to talk to. Richard, good morning to you.
Good morning, Clive.
Thank you very much for joining us. So, a year on, first of all, I mean, did you imagine that a year on we'd be where we are now?
No. If I'm completely honest with you, I think that I completely underestimated that this would take, the toll that it's taken in terms of human life, the disruption to our society. You know, I don't think we thought we could have had a period of such disruption. We're literally going backwards in our history. And I think that's been shocking for governments, and it's been terrifying for people. So, no, I had no expectation it would be as bad as this.
So, in that respect, then, obviously, the mistakes have been made in all sorts of ways, and lessons have been learnt over the year. But should we maybe give a little bit of leeway to our government and other governments, given that really nobody did foresee this?
Well, when you say nobody foresaw this, that's not totally true. We knew that a pandemic was going to come. We knew that it was going to be a virus, and we knew that it was most likely to come from a virus that jumped from an animal into a human population. What we didn't know was when it was going to come. We had SARS back in 2002, 2003. That was the early warning signal. So you could say that we've had 20 years to prepare for this moment.
Do you think that might have given us a false sense of security, that we think, well, we had SARS and it didn't lead to what we've got now?
Absolutely, Clive. I've gone back and looked at all of the investigations after the SARS outbreak 20 years ago, and there was this sense of triumph. The sense that this was a spectacular success that the global health community had pulled off, and that we all patted ourselves on the back. There are a few people who said, be careful, don't be complacent. But by and large, we thought this was a triumph, and that we didn't have to worry. But of course, we made a fatal mistake.
So what would you say are the key lessons that we've learnt from this year then, and that we can put to good use in future?
So I think the first point is that over the past 40 years, we have built societies in the West which have been modelled on efficiency, a kind of just-in-time culture. And when the times are good, efficient societies work well. When times are bad, efficiency literally kills. You need resilient societies. You need to be able to build in some spare capacity. And that's what we didn't have. We didn't have a health service that could cope with the kind of crisis that we have had. We had to turn off routine care, cancel elective procedures, which has had a huge toll. We didn't have a public health system that had adequate testing capacity. And that has just been devastating because we were literally flying blind for the first 6 to 8 months of the epidemic. We had completely erratic and confusing communication with the public. We didn't understand how important building trust was with the public. And I think overall, when you look back at the last year, we've been too slow. We've been too indecisive. Contrary to what government says, we didn't follow the science at every step. And we were unwilling to do what it takes to squeeze this virus out of our communities. With the result that right now in Britain, we have the virus still rampant in our society 12 months on. And that shouldn't be where we're at. We should have been able to take it out of our society, and we haven't.
So do you see, going forward, we will have a rather different health system, one that has much more spare capacity? We train more doctors and nurses, or do you think we're just going to forget and go back to, the kind of make-do option?
I don't think we're going to forget. 100,000 deaths, and it's not going to stop now. We've still got months of this to go. I think it would not surprise me if we got up to 150,000 deaths later this year. And I don't think that the British people are going to be able to just quietly sweep that under the carpet and move on. I think there's going to be a period of deep reflection by the government, by the British people, on what kind of a society we're living in. The way I would put it is that this pandemic has held a mirror up to our society. And we've looked in that mirror and we've seen who we are. And we've seen the terrible inequalities, the fact that some parts of our communities are at particular risk, Black, Asian, minority, ethnic communities, people who work on the front lines to keep our society going. And we need to do more to protect them. We need to do more to prevent the kind of toll that they've had to endure. So no, I'm actually quite optimistic that we will learn the lessons.
Just going back to the course of the year as well, I mean, there was this huge difference in the summer where people were almost relaxed into normal behaviour. In fact, the government were bribing us to go out and spend money in restaurants and so on, and then it all went wrong again. Do you think that is did we make terrible mistakes in the summer, or is that just part of the normal course of a virus, that it gets better and then it gets worse again?
Well, I think we've laboured this past year under several distracting myths. First of all, we thought herd immunity was going to save us, and clearly it didn't. Then we thought we would flatten the curve, and we did flatten the curve, and that's what you're talking about in the summer. I remember it very well, August bank holiday. The sun was out, we all went out, sat in restaurants. I can remember sitting in Kensington outside the museums with my family, enjoying it like everybody else. But I do remember a moment actually sitting there and watching that, no physical distancing, no mask wearing, everything was back to normal. And that was the moment, actually, when it took off again. So we didn't learn the lessons from the first wave, because the only way that you're going to control a virus like this, and it's a nasty virus, is you've got to suppress it. You've got to get on top of it. And after the summer, after that August bank holiday, we've never quite had the determination to get on top of it. I mean, right now, we have a partial lockdown, not a really serious lockdown, and we're pinning our hopes on the vaccine, digging us out of this. But the vaccine on its own is not going to dig us out of it, and it's going to take a long time to dig us out of it. So I'm really worried that we haven't still grasped the seriousness of the situation that we face.
How hopeful are you about the vaccine situation, with more apparently in the pipeline, some fairly encouraging results, lots of vaccines out there now? Will that eventually be the route out of it, even if it does take months or even a year? Do you see that as the route to something more normal, And will there ever be the old normal?
It's definitely the route out. My worry is that we are, again, over-promising in terms of dates. You know, we've got this mid-February figure for a moment of review. But look, if you get through the first 4 priority categories of JCVI, that's about 14, 15 million people. That's great. But then you've got to get through the rest of the JCVI priority list. That's another 16 million. That takes you to 30 million people. But we're going to have to immunise about 3/4 of the British population to get to herd immunity. So that's another 20 million people that we're going to have to get. So it's not going to be until after the summer, going into the winter of 2021, before we get anywhere near herd immunity. And then, Clive, it's not just us, because this is a global pandemic. So even if you protect the British people through immunisation, we need France, Italy, Spain. We need America. They need to be immunised and protected too. Otherwise, we're not going to be able to go anywhere. So this is a global predicament where we all have to work together. And that's why this situation with vaccine nationalism right now and this crazy fight within the European Union, and are we going to give vaccine to EU or not give vaccine, is so damaging, because we're all in this together. We're not an island.
And is there a prospect that we might be getting a vaccine, do you think, every year, actually quite regularly because of variations?
It's very likely. What we know about the natural immunity to other kinds of coronaviruses is that natural immunity lasts for about 40 weeks, so less than a year. So it's likely for this particular virus that we will need to adjust the vaccine every year and have a shot just like we have flu shots. So I think that's going to become the new normal. I think we will return to a normal society. It will take not just 1 year, but several years. So my timescale is 2 to 3 years. And during that 2 to 3 year period, we're still going to have very careful border controls. We're still going to have to monitor our behaviour, some physical distancing, mask wearing in certain situations. But after that period, then I think we're going to have routine and regular coronavirus vaccine immunisations.
Richard, thank you very much. Richard Horton there, Editor-in-Chief of the Lancet